Hi, I'm Dr. Langley with Pine Ridge Family Medicine. So I've been having some technical difficulties around here. I have a new computer now because my last one died, and I'm still figuring out how this computer works with this camera. And I'm super pregnant. I'm at 31 weeks now. This is my sixth pregnancy, fifth baby, and wanted to talk with you about what I'm doing for exercise during this beautiful third trimester that I'm in. And I really look worse than I feel. I've got this place where I walked into my chicken coop on my forehead. I've got these two spots that I froze on myself with some liquid nitrogen. And this camera just doesn't quite look the same. So hopefully this turns out okay enough to put on YouTube and to bring some education to you. So I'm right there with you. I've got my big old pregnant belly. And as per the norm, I'm worried about in this last trimester trying to stick to the weight gain that I set as a goal for myself. And it's not easy, especially because, man, this baby, from previous pregnancies, I remember those last few weeks, baby just puts on a lot of weight, which is what we want. We want baby to weigh a solid amount. Mine tend to weigh 7 to 8 pounds, and that's definitely how much I want them to weigh. Whew, but they put a lot of weight in that last couple weeks, and I've spent all of these 9 months, 8 months, gaining weight as well. So, what is the benefits of exercise during pregnancy? Well, there's every single organization that I'm aware of that I trust says, yeah, working out during pregnancy is great. It's great for you. It's great for the baby. It helps you to not gain too much weight. It helps to prevent injury. If you're working on strength and balance throughout pregnancy, then you're less likely to have a bad fall, something like that, where you're hurting yourself. And it helps you bounce back after delivery a lot more. I'm not saying that it feels at all bouncy. It does not a fast recovery from delivery generally, but it's definitely easier if you've got some of those muscles that have been being trained during pregnancy to make both delivery go better and to help your muscles go back to where they used to be after you do deliver. Given all these benefits, there are definitely some indications where you shouldn't be exercising during pregnancy. If you have bad anemia or low iron, you really just don't have the red blood cells to supply you and the baby the oxygen that you need. So exercise is not such a great idea. If things are starting to happen towards delivery, such as your membranes rupture, that would be a reason to not exercise. Maybe go on a short walk before you go to the hospital, depending on what your doctor or your midwife is telling you to do. If you're having issues that you're needing to see your OB more often than usual, things like cervical insufficiency or a lung disease or heart disease, placenta previa, having a history of premature labor, having preeclampsia or high blood pressure with, or even seizures with previous pregnancies. Those are all pretty serious things that you should talk about with your doctor first before you decide what you should do for exercise and how vigorously to exercise. So if there's any doubt about it, definitely talk with your doctor. I'm a big proponent of having a good relationship with your doctor. Hopefully you can find a direct primary care OB around you. They do exist and they're very cool. But in the meantime, so here I am in my pregnancy. What have been the key exercises that have gotten me to this point and that I'm really relying on getting me through to the end of pregnancy? And if I had to pick one exercise as the most important to do every single day, it would be Kegels. I'll post a link to my other video that talks in more detail about Kegels, but that's the lower pelvic floor muscles that help to support baby, as well as your bladder and your digestive tract, your intestines. So think of all the important things involved there. So to really fight off urinary incontinence, that leakage when you cough or sneeze or jump or do any or really have to go, Kegels are just so key. So doing Kegels every single day from start to finish of your pregnancy and of life, as especially a woman, is just essential. So that's my number one exercise that no matter what, I highly recommend. And then from there, most of the exercises are just to keep you moving and limber and have your back feel decent. I really like lateral stretches of your spine during pregnancy. It's so easy to just let your posture go and to have that, let your stomach stick out a lot and think that Straightening it up is the only other movement it needs to make, but your spine really needs to move from side to side every single day too. And along with that slouching of your belly sticking out, making sure that you're combating that with what's commonly called cat-cow stretches. So when you do the cat stretch, that's the most important one, where you're really arching your back up and away from where your belly wants to pull it. Don't do too deep of cow stretches. I mean, it's really easy to stick your belly way, way out there. And that's not what your back needs so much. Your back really needs you to fight that, to be using those abdominal muscles as much as you can throughout the day. Keeping them tight, feeling like you're lifting your baby, I think is really good for your core, for your back, and for your hips and back to not feel so miserable and achy all the time. So I really like those a lot. I like sitting on the floor. That's kind of a weird one, but especially like that tailor sit where you bring the soles of your feet together. I used to call it a butterfly stretch. Growing up with doing ballet as a little girl, whether you flutter your wings of your butterfly is up to you, but mostly just sit there and get that stretching through your hips, through your inner thighs, can be a nice relief. I also really like squatting, especially in the third trimester, starting to stretch out all the things that need to stretch out in order to be in a squatting position with your knees way apart. I usually put my hands in kind of a prayer position, pushing my knees apart even further to kind of get ready for that kind of a position, whether when you deliver you're actually squatting on the ground like that, or if you're on your back delivering. Very common, but you'll be kind of in a squatting position then too. So to be comfortable in that position and have your pelvic floor and your upper legs stretched in such a way that they're used to that and it's not going to be too crazy uncomfortable. And really any other exercises, if you've gotten to this point, those are the basics, I think. And then in addition, cardio is wonderful, whether that's walking at this point. Some pregnancies I think I've run still in this trimester. Not in this pregnancy, though. There's some walking going on, though. Walking is a wonderful cardio exercise, limbers up your hips a little bit. I really like swimming, too. Swimming is fantastic. And then also strength and balance exercises are great, too. If that's something that you've been doing all through pregnancy, if it's something that you did before pregnancy and were really comfortable with, make sure you dial it back to something that your body can handle more easily. This is not the time to be pushing yourself as hard as you can. But I do a lot of bar exercises at home. I use 5-pound weights, and those are really comfortable for me right now, but I've been doing that all through pregnancy, so that's what I'm used to. And that incorporates some balance, which I really like. In previous pregnancies, I've had my weightlifting regimen that I continue all through pregnancy with pretty light weights, but I think still heavier than 5 pounds. And I really like standing on one of those balance type things that they have at the gyms, whether it's a flattened looking balloon or the black platform with a half of a yoga ball on top. I'm sure there's more technical names for that. But standing on top of those while I was doing my weightlifting, my biceps, my triceps, my shoulders, I really liked doing that for both the strength aspect and the balance aspect. And I felt like that helped me to be more comfortable, even as my hips start feeling like they're completely falling apart. And every time I try to put on pants and standing on one leg is just excruciating and it feels like I'm standing on nothing at all. I think those balance exercises have helped me to maintain what dignity and balance that I can, even all the way to the end of pregnancy. So hopefully you found this useful. Hopefully you can relate if you're in your third trimester too, and I'm not alone in feeling that these are, it's a rough time, but you can do it. And soon you'll have an amazing baby to hold in your arms, and it will be wonderful. I've been there, I've done that, and I want to do it again, apparently. So if you want to see more pregnancy videos, click right there. That one might be helpful for you. And please subscribe to my channel here so you can find out when we release new videos. Thanks for watching.